Hello, everyone, and welcome to Health 180 with Carrie and Fan on Rogers TV. In 2001 census data, about 5,400 individuals living in Canada studied in a foreign institution and arrived in Canada at age 28 or older. They account for 16% of potential physicians available that year who meet the educational requirement to practice medicine in Canada. Today, I'm joined by Dr. Francis Okoroh, family physician at Adelaide Medical Clinic. We want to help you learn more, so let's learn together. Dr. Francis, welcome to our show.
Hi, thank you for having me.
Glad you can join us. Tell us a little bit about yourself. I know sometimes we see ourselves a little bit differently in society. Who is Dr. Francis?
My name is Francis. As you mentioned, I'm a family physician. I work in downtown Toronto at Adelaide Medical Clinic. I'm of British descent with Nigerian parents. So I've recently moved, having done medicine in the UK. I moved to Canada about 15, 16 months ago, and I've had the amazing opportunity to practice medicine as a family physician over here. And I've been fortunate enough to sort of navigate through the system, open a clinic recently. And it's my passion to sort of look after the local community and try and progress in terms of my own personal development over here.
So, what inspired you to get into medicine?
I think that typically when you have Nigerian parents, one of the things that comes with that is trying to push you. And I had some influences around me that I think is really important. I had an uncle who was a physician, and I had lots of family friends who were also in that profession. So I think it was almost a buzzword early in life that I tended to hear. And without even thinking, I thought, this is what I want to do. And then through school, through sort of studies and experience, I decided that I like science. I like the opportunity to use my brain to try and figure out problems. So it all kind of meshed together.
Can you share with us a little bit about young Dr. Francis? I know you were a doctor then, but what were you like growing up?
I was quite shy as an individual. So without obviously seeing me physically, I'm very tall actually. So in height, I'm 6 feet 8 inches. And I think that any
Unbelievable. I have to see that for myself.
yeah,
No.
I know. So you don't necessarily see too many people of my height. And that meant that growing up, I always felt different. So I was quite shy. I always had my head down. I wanted to try and make myself small, ironically. But I think with time, with sort of developing the passions that I had in terms of getting into science, exercise, sports, things of that nature, I found myself. And I think now it's kind of interesting and ironic because most people that know me now know that I'm quite an outgoing, confident person, but that couldn't have been further from the truth growing up.
I think society would expect you to be like a basketball player with that height.
Wasted talent, man.
Can you share with us your education background, the requirements that you had to fulfill to become a doctor?
Of course. So, obviously, following completing school, so regular school in the UK, I moved on to university or college, and I did 5 years of medical school in the University of Leicester in the UK. Following completing those 5 years and becoming a doctor and getting that title, I then did postgraduate training. So that's another 2 years of what we call in the UK foundation training, which is when you're doing your residency and sort of working lots of different rotations and specialties, learning your trade. And then I did a further 3 years of family medicine training in the UK. So in total for med school, which was 5 years, and then the extra 5 years post med school, it was 10 years of training in total.
So, what did you have to do to practice in Canada?
Yeah. So lots of people may not know this. The pathway to practice in Canada and in Ontario has changed recently, meaning that because of the shortage of family physicians that lots of people are aware of, they made the pathway quite easy to transition from the UK. So physicians who already are practicing as a family doctor in the UK or in the US are able to transfer over to Canada, so long as you do your licensing, which is not exams, it's just getting
Mhm.
your qualifications from your respective country verified.
So why did you choose family medicine? You could have gone into other areas. Why family medicine?
Yeah, I think as I was sort of training, my main passions were sports medicine, family medicine, and working in the emergency room.
Mhm.
And to me, family medicine provided the best balance of sort of work-life balance as well as variety. And I think that ER was fast-paced, exciting, but it's very tiring. And I think that the reality of the situation is that I'd love to do some ER, and that is something that I will probably look into doing down the line alongside family medicine. But family medicine has provided lots of challenges, but at the same time, it's provided a better work-life balance.
So, when you first came to Canada, how was that to adjust to practicing? Were you having a lot of fun when you first started practicing medicine in Canada? What was that like?
I like to be thrown into the deep end, to be honest with you. So when I first came here, obviously learning the new guidelines, learning how systems worked,
Mhm.
sort of meshing with new patients from lots of different backgrounds. All these were things that I thought was very, very interesting to sort of process when I first moved. But all
Mhm.
in all, Canadians, as you know, are very friendly. People have been very welcoming. I've fallen on my feet. I can't really complain about the whole process. I think that, as with anything, once you dive into it with time, you become more confident.
Did you face, were there any barriers or challenges that you faced in your early stage of integrating into Canadian healthcare system as a physician?
I think that the main thing that I faced personally was sort of learning the new system. So,
Mhm.
understanding, for example, what services are provided via OHIP, which is obviously the Ontario Health Plan.
Mhm.
So, it was trying to figure out which services do we need to get patients to pay for, which services actually are covered via the sort of national health plan.
Mhm.
So from sort of learning that and working over a period of time, obviously it took a few weeks to get confident with that. Other than that, I would say that medicine is medicine, and working in the UK for a number of years as a family physician, it translated quite well to working here. It's the same sort of principles you're going through. It's just the systematic differences.
Mhm. I know you mentioned in regards to like we have a lack of family physicians
Mm,
here. I know that through being a part of Lakeridge and how dire the need is for family
yeah.
physicians. So when you see a family physician, you're like, yes, right? But I want to ask you this personally. Apart from that, why did you decide to leave the UK to venture into Canadian medicine? That had to have been a difficult decision to make, or maybe it could be easy because we're so friendly.
Yeah, I think the reality is that moving across and traveling from one continent to the next to find work and to relocate your life is one of the biggest decisions you can make in life.
Mhm.
So I didn't take it lightly. I did a lot of research. I'd had friends that had worked in Canada, had given me great reviews. And it was at a time in the UK where there was lots of change going on in the healthcare system in the NHS in the UK. And I thought about it for at least 2 years. And then one day, you know how it is, you wake up and you think to yourself, I'm going to do it. And
Yeah.
then, yeah, literally did the research, did the verification of my documents, got the application going. And then within sort of 4 or 5 months after that awakening, I was here. So, yeah,
Yeah. We're happy you're here because
me too.
we need all the help we could get
Yeah.
in your area. And I've got to ask, a member of my team asked me to ask you this question,
Okay.
so I've got to ask you this question. How do patients react to your accent at first on the first visit?
Interesting. I often get are you Australian or from the UK? That's something I get quite commonly. But I think one thing I will be honest about is that we're lucky being from the UK that people like our accent. I just think it's a normal
Yeah.
thing, yeah. But people seem to really like it. I think that the UK accent, for whatever reason, has some sort of connotation with intelligence, even though
Yeah,
not everyone from the UK is intelligent. But
yeah.
I think it's an icebreaker. When you first start speaking, people think, oh, they're from somewhere different. So it's a plus.
I think after a while, because a close friend of mine, he grew up through going to school in the UK, so he has a British accent. But after a while being around someone, you tune it out. You just sound normal.
Yeah.
So whatever accent you have just disappear to the ear,
Yeah.
right? Because I turn around now, I'm like, what happened to your accent? I thought you had an accent, right? But it's interesting how we hear things and how we adapt and
A
stuff like
thousand percent.
that. In terms of young people who are
Hmm.
looking in to get into medicine, what is one tip you can give to someone who's considered getting into medicine practice, medical
I
practice?
would say find mentors because as with lots of other careers, it can be quite daunting because, let's be honest, the training is rigorous. You have to sacrifice lots of your social life. You work long hours. And for lots of people, after a period of time, you kind of think to yourself, is it worth the whole journey? Because now, yes, I do still have challenges, but at least I've made it to a level now where I've gone past all that training and I'm a qualified family physician. So I think that during the process, having somebody you can physically look at or speak to who's in the position you want to be in is really, really important. So I was somebody that stuck my neck out and tried to seek mentors. I'd speak to people, I'd be annoying, ask them questions, try and shadow them. So I think that anybody you can get your hands on, you really have to try and do that. That's really important.
So mentorship plays a key role
Yeah.
in getting in the field.
Yeah, 1,000%. I think once you see somebody who may look like you or you aspire to be like, or can give you some advice and allow you sometimes to not make the mistakes they have made along the way, those sorts of things are invaluable.
Yeah, and that's so crucial and important. When you can see someone that looks like you, it helps
Yeah.
to motivate and inspire you. We are exploring family medicine healthcare system in the UK versus Canada with Dr. Francis Okoroh. My name is Carrie Fenn, and we'll be right back.
So for me, working here, it's been quite similar, to be honest with you, because I have to deal with patients who the majority of services they get they have access to, and it's free healthcare. But the challenge has been trying to ensure that I'm aware of the differences between the systems. So when patients are coming to me, ensuring this is a service that actually we can provide, and this is a service that doesn't necessarily have to be paid for out of pocket. And learning all those things in the first few weeks and months of being here was quite challenging. I'm going to get changed into my scrubs and get ready for the day at work. See you guys in a bit. So one thing that patients tend to ask me is, can I bypass the healthcare system? So when I refer a patient to, let's say, a dermatologist, and they may want to be seen quite quickly, there is no option of private healthcare in Canada. And that means that often waiting times can be quite long. In the UK, notoriously, the waiting times in the NHS are extremely long. But there is an option, because of the two-tiered system, to visit the private healthcare system, within which appointments are very quick, but obviously it's a very costly process.
Welcome back to Health 180 with Carrie and Fan Rogers TV. My name is Carrie and Fan. According to the 2001 census data, 90% of Canadian born who studied medicine are working as physicians, while 55% of international educated work as doctors. Dr. Okoro is back with me to share more about healthcare in Canada versus the UK. Um, this is quite an interesting conversation because I've heard of quite a few doctors who study. Some too have seen come from like Africa, and they would go to the UK, and then they would venture into Canada.
Mm,
One of the things that I've seen that's consistent is the intensive education, the intensive experience. And I think that translates into like more excellent service and more understanding in terms of healthcare and treating patients. What do you think that type of experience, that type of education,
mm.
that type of background bring to the table in terms of healthcare and healthcare where we're at now?
Of course. So I think that given that we live in a very multicultural environment, so if you look at Toronto as a city, it's extremely multicultural. So I think the exposure having practiced medicine elsewhere can sometimes lend quite a lot of advantages because it means that you've seen so many different backgrounds, whether it's from a socioeconomic or an ethnic diversity related background. When you train, so lots of people, as you mentioned, have come from different places within Africa or the Asian continent. They have a slightly different pathway. So they're called international medical graduates, and often their qualifications, unfortunately, aren't seen the same as, let's say, a UK, a US, or a Canadian qualification. So there's a slightly different transition they need to make. Lots of the time, they have to actually apply to do residency in Canada before they can practice here. So some of
Mhm.
them do go to the UK, as you mentioned initially, to get their training there before coming to Canada.
Oh, that's why. That's why. I've seen, like, even through our charity, I've seen so many immigrants who come to this country and they have like such intense educational background,
Mm,
and they do have to apply for positions that they far exceed the expectation, but because the
mm,
difference in the educational system is like a step back. But I think it's a loss on our society in that aspect. But it's nice to see that there's a transition in terms of I guess in doctors, because we need doctors
yeah.
for you to be able to practice here. So did moving countries to practice medicine change the type of doctor you are today?
I think that's a great question. I think that since I've been here, I've definitely learned to become more patient.
Mhm.
And I think the reason that I've become more patient is because I'm dealing with so many different patients from backgrounds that I've never encountered before. So if you think about the people from, let's say, the Caribbean, people from Latin America, people
Yes.
from Southeast Asia. There's so many different people, and often you talked about accents and people dealing with my accent. You
Mhm.
have to obviously pay attention to the different accents you hear from patients here, especially
Yeah.
in downtown Toronto.
Yeah.
So I think that sort of understanding that there's so many different healthcare needs, people are used to different healthcare systems as well. So they're used to having regular checkups or infrequent checkups or certain types of investigations done. So I
Yeah.
think that sort of trying to understand their expectations and also bringing them into awareness of how the Canadian system works has been quite an interesting challenge, but something that I've enjoyed.
It, it's nice to see that you see things like, because I know sometimes I look on TikTok and you hear the Canadian accent, and mostly they show like young people and are like, man, I'm
You
so
do.
embarrassed. Do we really sound like that?
I like the Canadian accent.
Yeah. Oh my goodness. Um, did anything about the Canadian healthcare system surprise you?
Yeah, I think maybe not massively surprised, but I think that the things that were sort of a transition for me was understanding that things like psychotherapy, so talking therapy,
Mm,
isn't covered via the government health plan. So
mm,
lots of the times, patients who are suffering from anxiety or depression or other mental health conditions, they
mm,
often need to pay for their talking therapy, or they
mm,
need to use their, let's say, work insurance to cover those provisions.
mm,
So understanding things like physiotherapy, psychotherapy aren't covered was quite interesting for me. And also, I think that some people here complain about the waiting times of certain things like getting scans, as well as other investigations. You'll be
Mhm.
surprised to hear that actually in the UK it takes longer. So
Oh,
yeah,
wow.
so actually, I do understand the reservations people have about how long things take to happen, because obviously, if you're waiting, sometimes your health can deteriorate in that period of time. So
Yeah.
it's really bad in some aspects, but the reality is we have a very big population and not enough doctors, so it takes time to sort of get through all the different tasks that are there to be done.
So do you guys have a long wait time for hospitals as well, waiting room?
We
Oh,
do,
you
yeah,
do?
yeah.
Okay, okay. I always used to get like community members complain to me all the time when I was a trustee, and they'd be like, we have to wait so long." And then I would have like the chief of staff, who was the chief of staff was staff to the board, but he used to say to me, if it was really that serious, you'll go right through, right? Until I saw it for myself, like in this, like, I know that it's a wait time,
Yeah,
but no disrespect to anyone who's sick, but when it gets that serious, yeah, you go straight through,
yeah,
right? But you have to prioritize, obviously,
a
right?
thousand percent.
Yeah. So on the average, how many patients do you see per day here in Canada?
So it depends on doctor to doctor. So I usually work, let's say, 9.5 hour days, Monday to Friday, and I'm probably seeing anywhere between about 40 to 48 patients per day.
Mhm.
So by the end, you are quite tired and exhausted from it. But there are some varieties. So most of them are face to face, but we do also do some virtual care, so some video appointments, some
Mhm.
telephone appointments, which helps to provide some variety.
Oh, wow. That can be draining, I would
Yeah.
imagine. Is it the same amount of patients you see in one day in the UK, or is there a difference between?
I
Uh,
saw slightly less in the UK, so not by much, but I probably saw on average probably between 38 to 40.
yeah.
But the system's slightly different here in that we accept walk-ins, whereas in the UK, the whole concept of having a walk-in clinic, it's not very common in the UK compared to how it is over here. So
Mhm.
sometimes you have a day that's sort of packed out, and then you actually have walk-ins on top. And we have a policy at Adelaide Medical Clinic of not turning away walk-ins.
Mhm.
So sometimes your day can be very, very busy.
It's very impressive to see that you've been here for 15 months and you've not only in the healthcare field, but you are a business owner.
Mm.
What does that feel like? That's a big accomplishment. There are doctors here who been practicing and not necessarily have their own practice.
Yeah.
What is that like?
I think that it's been a tough transition. I think that nothing in life, as the cliche goes, nothing in life worth having comes easy.
Mhm.
But I'd always sort of set my sights on trying to have a clinic that I could be proud of.
Mhm.
And the sort of difficult thing that I found is delegating, because I think that when you first start something, you're always checking your emails, you're always trying to think about how you can make things better. But actually, the real power comes in having a team of people that you can trust in. So, yes, it's been a very quick transition, but an opportunity came to me that I thought, yes, I can actually do this and improve the local community by having a service that I'm proud of and caters to them. So if I think about the fact that I've come here and made that transition, yes, it sounds like a crazy journey, but over the past few weeks, it's all made sense and it's all fallen into place.
Mhm. So how can someone book an appointment with your clinic?
Yeah. So all they would need to do is to go on adelaidemedicalclinic.ca on the website, and they could register as a new patient and book an appointment that way.
Mhm.
So that's the most common way that people would obviously book an appointment. But often we do get walk-ins as well. So they would come to the clinic, which is on 400 Adelaide Street East, and they could obviously come in for a walk-in appointment.
Yes. I have to ask you this. This is one of my, well, two of my best words when it comes to the medical. Um, What I want to know, what's your view of best health? Because often we tell people, or
Mhm.
we put it up on people, individuals, to have a standard of health that is far greater than what they could reach. What is your interpretation of best health?
So my interpretation of best health would be empowering yourself. So
Mm,
the key for me is that as doctors, yes, we do have a position of privilege in that people look at us as sort of gatekeepers that can give advice, provide investigations, provide medication, and treat conditions. But
mm,
actually, this only serves as a minority percentage of your overall health. In order to have your best health, the key things are to be consistent, whether it's with your diet, your exercise, your mental well-being, all those sort of holistic factors of life, I think amalgamate together to provide your own best health.
What is one tip you can give to a doctor transitioning to practicing medicine in Canada from the UK?
I would say that my doors are open, so I'm always happy to provide advice personally. But jokes aside, I think that the key thing for me is to do research.
Mhm.
So it is quite easy to come over here and to be in some aspects in a setting that's not right for you. So I think that understanding what is the local community like, what is the clinic like, what are the clinic owners like, what are my colleagues going to be like, is there an opportunity for me to come and shadow before I sign a contract? All these things are really key because you don't want to make a massive transition and then find you're in a situation that you're not happy in. So I think that doing your research is everything.
Yes, and that is actually good advice. That's all the time we have for today's episode of Health 180 with Carrie and Fenn on Rogers TV. My name is Carrie and Fenn. Thank you to Dr. Francis for joining us from Adelaide Medical Clinic, and thank you for joining. And remember, together we are stronger.